My name is David Troxel. Welcome to part 2 of a 3-part series of webinars sponsored by Trilogy Health Services. And today we'll be talking about managing the challenges of dementia care, a Caregiver's Toolkit. I'm so pleased to partner with Trilogy as a consultant to their program. To tell you a bit more about myself, I'm the co-author of the Best Friends Approach to Dementia Care, and again, a consultant to Trilogy Health Services and its BFF Memory Care program. I'm known for my writing and teachings about dementia care, and I've co-authored 6 influential books and many articles, again, with my writing partner, Virginia Bell. I've worked in university and Alzheimer's Association settings and currently work as a writer and dementia consultant. Like many of you on this webinar, I'm sure, I've also been a family care partner for my mom, Dorothy, who passed away in 2008 with Alzheimer's disease. One of the joys of teaching virtually these days is to be able to reach out across the internet and talk to so many people. And I'm so pleased to do this today again for Trilogy, who's a licensed provider of the Best Friends approach with its innovative and life-affirming BFF program. Today's presentation will talk about caregiving today, the challenges of dementia care, helpful strategies for education and self-care. Often it's important to be sure we're taking care of ourselves as caregivers, and we'll be talking about a toolkit that will give you lots of good ideas for everyday care. I'll be talking about the importance of planning ahead because we know that almost all of these dementias are slow and progressive, and so it's important to look about what to expect next week, next month, next year to make those plans. We'll be discussing resources, and there'll be an opportunity for you to send in your questions that we'll respond to after the webinar. So let's reflect on caregiving today, and certainly a woman who's had a tremendous impact after being First Lady for 4 years, Rosalind Carter, has embraced the importance of caregiving and the importance of elder care. And I love this quote from Rosalind. She says, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will someday need a caregiver." Again, Rosalind, thank you for your leadership in this area. Another group that I greatly admire is the Mayo Clinic, and they've been a national leader with Alzheimer's disease care. And I think this from their website and their publications is very interesting, that caregiving is indeed rewarding, but stressful. Caregiving can have many rewards. For most caregivers, being there when a loved one needs you is a core value and something you wish to provide. But a shift in roles and emotions is almost certain. It's natural sometimes to feel angry, frustrated, exhausted, alone, or sad. Caregiving stress, the emotional and physical stress of caregiving, is common. And what I take away from this quote from Mayo Clinic is the importance of saying that for many of us, I know for myself too, it was satisfying to be there for my mom. I wouldn't have wanted anything different. I gained a lot of joy in being with her, even in the moment with dementia, but that doesn't take away from the difficult job that all of us face. Let's take a look at caregiving today, kind of our landscape around Alzheimer's disease. And I think many of you will be surprised by some of the information you'll be hearing in the next few minutes. Alzheimer's disease and these other dementias impact 1 in 3 families in the United States. 5 million Americans are cared for by 16 million friends and family members. The average length of life after an Alzheimer's diagnosis is approximately 8 years. And in part because of the longevity of care, studies have shown that Alzheimer's disease and other dementias are now the most expensive illness in the US. Again, thank you to the Alzheimer's Association and the American Public Health Association for this information. The fact that 1 in 3 of us are impacted by this disease, the fact that the numbers are growing, really do suggest that it's important to learn all we can, but also to reach out to friends, neighbors, resources. Many of us have traveled this journey personally as well as professionally. Let's again drill down and look at caregiving today. Caregivers spend on average 13 days each month on tasks such as shopping, food prep, housekeeping, laundry, transportation, and giving medication. Caregivers spend 6 days each month on feeding, dressing, grooming, walking, bathing, and offering assistance toileting. And 13 hours each month researching care services or information on the disease, coordinating physician visits, or managing financial matters. And so you think about all these tasks, you add on childcare, you add on employment, You add on just taking care of your house or apartment and doing grocery shopping and cooking, you can see how caregivers get so exhausted. I'm even thinking about the idea of taking mom to the doctor's visit or to the dentist. That in and of itself involves so many steps. And so we know that this caregiving challenge is very, very real. Approximately 2/3 of caregivers are women. More specifically, over 1/3 of dementia caregivers are daughters. About 1 in 3 caregivers is age 65 or older. And I've actually met in cases where there might be a 90-year-old caring for a 92-year-old. It can be very, very challenging. Most caregivers, about 2/3, live with the person with dementia in the community. And approximately 1/4 of dementia caregivers are what we call sandwich generation caregivers, meaning that they not only care for an aging parent, but for a child under the age of 18. Now, these statistics were actually gathered from the Family Caregiver Alliance well before COVID. So again, imagine that you also are in that sandwich generation, caring for someone at home under the age of 18 and over the age of 70. What do you do when grandmother runs out the front door and your 7-year-old runs out the back door? Who do you go after? How do you manage these things? Again, a lot of stress and strain made worse by our pandemic. The stressors. I think many of you can write your own book on this, but here are some things based on research and my own experience that, again, the stress of caregiving includes things like continence care, dressing, bathing. I think the difficulty of changing roles, it's so hard. I know one married couple I spoke to, the wife said, we did all of our decision making together. We did everything together. And now I have to step up. He can no longer do these things. So the changing roles, the adult children who in many ways become parents to their parents, it can be very, very difficult. Safety. There's lots of good material on safety from the Alzheimer's Association, but of course, we always worry that someone might walk out of the house during a snowstorm or drink a toxic, things like that. You really do need to, in many ways, Alzheimer's proof your home if you have someone at home right now. Guilt. Sometimes even the best caregivers feel guilty for the 1 or 2 things they couldn't get done, even when they're doing 100 other things. Sadness, loss, depression, social isolation, again, made worse during the pandemic, loss of past routines, hobbies, and the me time, the things that you really like to do, and the unknown. And this last one, I don't think actually gets talked about enough, but with some caregiving situations, you might understand that maybe your family member you're caring for in hospice, end of life, that perhaps it's a matter of weeks or months. With Alzheimer's, you often don't know whether someone's going to be alive in 1 year, 3 years, 5 years. Every person's so different. Again, it can be a very, very tough situation for caregivers when you just don't know how long you'll be in this situation. So again, as we look at the broad view of dementia, I hope I haven't painted too dark a picture here, but it's all the more reason to learn all you can in these webinars and be creative in using services, because we know that dementia is a public health crisis and certainly was even before COVID-19. I think you've seen from this material so far that caregivers face a financially, emotionally, and physically stressful experience. A wrinkle with COVID. So many services in the community are closed or offering limited hours. I spoke to a day center director just yesterday who told me that they're running around to their day center clients and bringing meals and spending a few minutes of time and visiting, doing social visiting, but that's not an 8-hour day that the caregivers were used to dropping mom off at the day center. So that can be very, very tough. And as one family member told me recently on Zoom during a webinar, my mom's Alzheimer's Day Center is closed. I'm homeschooling my kids. My mom's friends and family can't even visit her. I'm on the brink. And so we know that there's going to be a demand for dementia care as we come out of this. And I hope you all will, again, use this time, as we'll discuss in a minute, to do some sleuthing and investigation, understand more about dementia and some of the resources that are available for you. Now, I think it's time, I think I've set the stage. Let's jump right into what I'm calling a caregiver toolkit, which again, my goal in these webinars with my writing with the best friends approach, and I know that my friends at Trilogy share the same values, is to give you lots of practical tools because we know so many of you are at home right now. So I think step number 1 is use this time to read, to take webinars like this, to watch YouTube videos, to go to reputable websites like the Alzheimer's Association or Mayo Clinic, and learn some basics about dementia. Learn about the power and importance of acceptance and empathy. We've covered this in another webinar, but knowing this disease is real. When mother says President Eisenhower is doing a great job, you don't want to argue or correct. You want to say, I like Ike too, accepting where they're coming from. Learning the importance of communication, of slowing down and listening, of giving lots of compliments and asking opinions and giving lots of verbal cues and sharing your emotions. All of these things are some basics of good dementia care. The importance of redirecting people. If mom is at the door, instead of arguing with her and telling her she can't go out, maybe ask her to open up a cookbook with you and teach you how she makes her famous pumpkin cheesecake. Doing things together, again, a fundamental piece of dementia care we've covered in at least our previous webinar to some extent, is the importance of staying busy, of doing things, of activity, engagement, music. You want to create an interesting day for the person living with dementia the best you can to help them, really build their self-esteem and reduce some of these dementia behaviors. And of course, as I've alluded to, keeping a safe house, lower that water temperature a little bit. There have been cases where people with dementia have gotten scalded because they just can't quite process how hot the water is. Look at your locks and put in some bells and alarms. So if somebody does go out during the night, you'll know. Poison control, fire prevention, fall prevention. We think it's such a basic, but I remember before the pandemic, I made a home visit to a friend's family, and they had all these different sort of slippery area rugs. So watch out for that. Make sure there's good lighting, because people with dementia, in part because of their visual spatial issues, often they do have a greater risk for falling down. So again, another quote during this challenging time of COVID. I normally am in a room with 200 people, but how great to be virtual. And one person, I think, put this in their chat box: as a caregiver, you pivot and try new things because the old ways of interacting may not work anymore. And I think that's a really powerful sentiment, because Alzheimer's is a game changer. It changes the relationships, and the way you've always related to your family member is not always going to work. Their judgment's impaired, their communication's impaired. So again, you have to pivot and make sure you're doing some things a bit differently. So again, as we think about this sort of step one, learning all you can, Alzheimer's Association, wonderful organization, 24-hour helpline at 800-272-3900. They have people who speak lots of different languages, great social workers and experts. Their website just gets better and better all the time with lots of good handouts and materials. And I do encourage you, as you think about learning all you can, to check on some local resources, get a good medical evaluation and workup. Many areas have federally funded university Alzheimer's disease centers that have memory disorder clinics. If you check with your staff or friends at Trilogy, I'm sure they can help you find a number of these important university centers that will do an assessment or follow somebody. And there are a number of them within the Trilogy service areas. In fact, I started my career at the University of Kentucky in Lexington, which was then just one of 10 federally funded Alzheimer's centers. Zoom webinars, workshops, and again, of course, if you need something, feel free to email me or any of the folks at Trilogy, and they'll do some research for you and help you get through all this. Okay, step two of this Caregiver Toolkit. And this is something, that I think is so powerful, and something that as a caregiver is so easy to let go of, but taking care of yourself. There's that old saying that they would say on airlines, that if the oxygen masks drop, put your own oxygen mask on first, and then give it to your dependent adult or your child, because if we don't have that oxygen, we can't be there for somebody else. So exercise, keep moving, and the added benefit is we know that exercise is good for the brain, good for the body, may even delay the onset of Alzheimer's. So exercise is very good. Healthy food, eat well, drink plenty of fluids. Sleep. This is, very good for all of us, and something that can be so tough as a caregiver, but see if you can organize your life to make sure you get enough sleep. Some caregivers will hire someone to, spend the night, or at least part of the night, because this is so important. And again, this is not only good for all of us as caregivers, but there's actually evidence that healthy sleep hygiene is called. Healthy sleep hygiene is actually very good for the brain, and again, may help delay the onset of Alzheimer's in all of us. Meditation, listening to music, relaxation, again, is a stress buster, good for the body, good for the brain. Keep up with your doctor's appointments. And this one is important because I think even before COVID, many caregivers become isolated. They stop doing the things they've always done. I think it's so important to try to stay connected with friends. So turn it around and do some Zoom calls with your college roommate and your sorority sisters or some of your work colleagues or friends or cousins or different people to keep up that social engagement. And there are online support groups, even dementia cafes for people with dementia. So take advantage of some of those other online resources. Let's look at the third step of your caregiver toolkit, namely building your resources, because caregivers often wait and wait and wait to use services. And we don't want to do that as a caregiver. We want to plan ahead. So friends and family, ask for help when you need it. Be as specific as possible. Sometimes I've been through so many support groups. I mean, sometimes our friends and family are terrific. They're really there for us. They kind of know what we need and they're on top of it. Other times we don't hear a lot from our children or our brothers and sisters or friends and family. And I've had caregivers express a lot of disappointment about this. How come my son doesn't visit more often? How come my son doesn't pick things up? He should know what I need. Well, I agree. He should know, but often they don't. So if you have a informal family network or friends, ask for help and be specific. Honey, can you go? Maybe you're talking to your daughter. Honey, can you go and pick up my dry cleaning? Can you go to Costco and get me the following list? Can you go to the pharmacy and pick things up? I think when you give people a specific task, there's a better chance they'll be able to do exactly what you need them to do. So again, ask for help, be specific. Professionals, there are a lot of different resources out there as we look at elder care. I want to talk about one unique group right now that I think has been very useful for me in many family situations. There's a whole field called geriatric care managers, and these are typically social workers or nurses that you can hire on an hourly basis, and they'll come in and assess a situation. Even with COVID, they can put on their PPE and come and visit you. They will help assess the situation. They'll write up a game plan. They'll identify local services for you. And the great thing about hiring a kind of a third-party expert is, let's say this geriatric care manager says you must get in-home help 3 days a week for 4 hours, or it's really time to move to assisted living and look at memory care, or you need to work on your home and put the grab bars in. It's not me as a son telling my dad to do that or telling my grandmother to do that, where they're likely to say no. It's the expert, that the geriatric care manager says, Mom and Dad, you need this. So I like the idea of bringing in the troops, so to speak, bringing in some extra firepower to help you make things happen. And of course, local services, even though there are a lot of closures, check with your area agency on aging, your Alzheimer's Association, your friends, support groups. You hopefully will discover some reputable and good in-home providers, adult day centers, and of course, look at residential care programs as well. So again, this issue of planning ahead, I think I'll just mention one more wrinkle about it is, sometimes parents don't cooperate with their kids, for example. I mean, I'm an only child. I had a very good relationship with my mom and dad. When my mom got Alzheimer's, my dad didn't take all my ideas. He took a few of them. And that's okay, because people have the right to make their own decisions. But let's say your parents, for example, are not making good decisions. They're not eating well. They're not taking care of themselves. The house is in disarray, but yet they refuse to move. Well, in those cases, again, make your checklist, make your game plan. There will probably be an inevitable emergency, maybe hopefully a minor car accident or a flood at the house or other issues, or maybe someone will fall and break their left wrist and go to the hospital. When something like that happens, it provides you with a window to take action and make something happen. So again, if mom goes to the hospital, mom has dementia, maybe then is the time to get her even with a respite stay into assisted living or to get some in-home help. So take advantage. I hate to say it, but take advantage of some of these life challenges. But if you have your game plan ready, you can make things happen. Step 4, get your legal and financial affairs in order. The person with dementia is gradually losing capacity. Maybe mom and dad with dementia is still legally competent right now. You want to make sure that if this is the case, that they are able to help finish their power of attorney for healthcare and finances, make sure the will and estate plan is together. I have to say that, sometimes a husband and wife or two partners actually don't realize that it's important for them to have the powers of attorney for each other. Maybe you need to sell real estate or do things like that. Make sure you go to a good elder care law attorney or a good attorney to get these things done. And of course, if you don't have a power of attorney for finances or healthcare, it can make everything very difficult if you have to take over someone's affairs. So I hope I've given you many good ideas so far in this webinar. But one of my goals in working with Trilogy is to just talk about things that need to be discussed and sometimes are often overlooked. And this is the issue of how we feel as a caregiver and how some of us maybe take to it really well and some of us don't. I have met many family members who are just the superstar caregivers, who have their checklist, who go through and get lots of resources, and they kind of have a real natural resiliency. I have also met caregivers who say to me, David, I just don't have it in me. It's just not who I am. I don't think I'd be a good caregiver for my mom or dad. And so perhaps again, it's circumstances. Do you have a big family or a small family? What kind of house do you live in? How is your economic situation? It's really okay to say, you know what? I don't think I can do this. Be honest with yourself, be honest with others. And I think this can be very, very important. And if you feel that either you can't do it, or perhaps you've been doing it for many years and you're just feeling defeated, your family member is now up at night, you're losing sleep, the continence care has become challenging, you find yourself really physically and emotionally and financially just really strung out. I think in this case, again, be sure to open the door for resources, including Trilogy Health Services, legacy neighborhoods, where staff can do some of the major care while you maintain your social and family connections. Socialization, as we've talked about in this series of webinars, is so important for the person living with dementia. And there's another advantage of getting help, namely, you're surrounding your family member with other people who can interact with him or her, keep that social environment, and make good things happen. So again, what is the treatment for dementia? What is our goal here in using services and getting good help? It's to create a good day for yourself and your family member. And I always like to kind of put this slide in my presentations, even when we're talking about caregiving toolkits, because part of your toolkit should be to see if you can program some of these things for mom and dad. So create a day filled with music, art, exercise, conversation, some good food, some time out of doors on nicer days. Focus on friendship and affection that shows the person he or she is valued. And many of these ideas, and Trilogy builds them into their programming, are evidence-based and evidence influenced. We know that music actually lives in a different part of the brain than words and language. This is why your family member tends to love music and know all those old songs. Exercise, again, very important for the person with dementia. We know that many people with dementia enjoy art and collage projects, things like this. So socialization is very, very important. And if you're a family member listening to this webinar, hopefully you're getting your resources together, you're learning a lot about the disease, but also try to keep your person as engaged as possible and create this nice day for them, because it does build self-esteem, fight depression, which is an enemy of the brain, and reduce challenging behaviors. I'd like to say a word about long distance caregiving because many of us, with it being such a mobile society, don't live in our hometown, and your family member with dementia might live next door, or they may live 1,000 miles away. So what are some quick tips for being a long distance caregiver? Well, certainly in the old days, I would tell people to grab a yellow pages or a phone book and bring it home with them. Now, thanks to the internet, you can easily find local resources, formal and informal, maybe find a local meal delivery service, things like that. So again, build that local team of resources. I think pandemic has complicated things, but if you can visit your family members safely, make more frequent visits, but perhaps even shorter ones are okay, because you want to keep an eye on the situation and make sure things are fine, that your mom isn't playing the bogus Canadian lottery or being taken advantage of by somebody. You want to try to have your eyes on the situation. Pick your battles. Again, when you're coming in, as the next bullet says, sometimes, we're in a problem solving mode. We're trying to find a new family doctor and maybe tell mom and dad that they need to put in grab bars and fire the housekeeper, whatever. I think sometimes when you come in with too big a to-do list, it can stress out the healthy caregiver and you create conflict for yourself. So pick your battles, come in with 1 or 2 items, but mostly make it social. And if you are thinking about making a move, begin to sort of set the stage for that, to have them come closer to you, or to again think about, getting that higher level of care in that hometown. So again, as we look at the treatment for dementia, I want to praise Trilogy and their distinctive BFF program, again, inspired by that lovely phrase, best friends forever. Through Trilogy's health services BFF program, staff learn the unique life story of each person and use that story to inform every aspect of care. Trilogy helps their residents living in legacy memory care neighborhoods cook their favorite recipes, listen to their favorite songs, express themselves creatively, and exercise their bodies and minds. By doing so, I'm so happy to be their consultant. We help them find joy, both in memories that have passed and in present experiences. I'll just reflect on one aspect of this I think is so important. What Trilogy does is do a wonderful job on learning a lot about the person living with dementia. So if the person's favorite color is red, we know to compliment them on their red sweater. If they love cocoa, hot cocoa with a marshmallow, we make sure they get their marshmallow. And using this life story, praising somebody, gee, Bob, I can't believe you were, the teacher of the year for 5 years in a row. Again, it builds these intimate connections, these relationship-centered care, and adds to that great quality of life. And as part of Trilogy's efforts to have this engaging social day, I really like the Daily Rhythms program that is unique to Trilogy, creating a schedule based on our residents' energy levels throughout the day. The program offers structured activities and unstructured moments that allow for natural conversation. For example, a word game may lead to a discussion of a childhood memory of a favorite food or other topics. And of course, staff members, they take their cues from the residents and acknowledge whatever space or reality the resident is in. I think this is a very unique look at dementia care programming and activities because, again, it's very sensitive to the residents' moods, their energy. We can be spontaneous and creative, but also recognize that, like all of us, we have our ebbs and flows, highs and lows during the day, and to do some great programming when people's energy is high, and then maybe enjoy that herbal tea and lovely music as the day is winding down in the evening. The BFF program, again, being based on my work on the best friends approach to dementia care with my wonderful writing partner, Virginia Bell, is really very simple, that what a person with dementia needs is a friend, is a best friend. This social engagement, I think, has been so powerful at Trilogy, even during the COVID pandemic, the smiles, the affection, the little 30-second activities that help this person feel connected to life. Because when you're a friend to a person with dementia, when you empathize and communicate, and when you're creative about solving behavioral issues, the person feels safe, secure, and valued. Again, when they're engaged, involved in purposeful and fun activity, everything goes better. The Best Friends approach at Trilogy Health Services or in your home setting can reduce behavior and foster cooperation and success. So thank you for being part of this webinar, and I look forward to learning more about your questions. You can email them in later, but I want to just recap on some resources today. The Alzheimer's Association website at alz.org. The Mayo Clinic Alzheimer's Center, again, really a leader with lots of good blogs and discussion about various aspects of dementia care. The Family Caregiver Alliance is a terrific source of information about caregiving. There's another program that I didn't actually mention during the formal webinar, but it's called the Benefits Finder. It's actually a federal program, benefits.gov, where you can put in someone's information and social security number, and it can list out various benefits that might be available for the person, particularly if they're a veteran. And of course, if you are looking for a university research center with their memory disorder clinic to help you do an initial medical evaluation or do some follow-up, you can get them from this website here or contact your team member at Trilogy, and I'm sure they'd be happy to help. Thank you again for participating today. One of my heroes in the field, a wonderful writer and philosopher about dementia care, a great researcher from England, Dr. Tom Kitwood, said, "Caregivers are physicians of the human spirit." What a lovely sentiment to think about, hopefully empowering for all of you with the great work you do for your family member. my personal contact, you can reach me through my website, bestfriendsapproach.com. Follow me on Facebook. I have a very simple email, davidtroxel@gmail.com. Again, happy to answer any questions. And again, thank you, Trilogy, for sponsoring this webinar. Trilogy, where family comes to live. Every component of the BFF program is designed to make our legacy residents feel supported, loved, and valued. Words very warm to my heart, because at the end of the day, they're not just residents, they're our family. And you can learn more about the BFF program by visiting trilogybff.com. Again, thank you very much. And you can send in your questions and we will respond to them in a timely manner. Have a wonderful holiday season.